Toto Pierre doesn't know how his young son got sick, but he is happy he is alive and doing better. His sister was taking care of him. All of a sudden, he got sick. First, we went to the hospital, and then we came here, he told us. Here is one of 10 cholera treatment centers around Port-au-Prince, run by the international medical organization Doctors Without Borders. Doctors has treated more than 20,000 cholera patients at 21 centers around the country since the epidemic began. Stefano Zanini is the chief of mission for Doctors Without Borders. He says it is difficult to predict when the epidemic will peak, but he expects it will continue for several more months.
But we are predicting, for example, the peak in Cité Soleil is very poor slums in the north of the capital city between 26 and 29 of November. Then again, 1, 2, 3 weeks later, we will probably face other peaks in other parts of the city and of the country.
Medical experts believe the epidemic began as a waterborne bacteria in the Artibonite region north of Port-au-Prince. Cholera bacteria are spread through fecal contamination, poor hygiene, and lack of sanitation. The bacteria induce severe diarrhea and vomiting. Victims can die from dehydration in hours. Health workers say one of the biggest problems they face in Haiti is that people do not understand what cholera is or how it is spread. We visited this street in downtown Port-au-Prince where people come to get city water. This water had a foul odor to it. Jethro Landell told us he will bathe, clean, and cook with it. I am not afraid of getting cholera, but for me it does not exist, he told us. City officials have asked residents to treat the water they use, and they have distributed treatment tablets to the public. But many residents like Marie Santilia don't have the tablets and cannot afford bottled water. I am afraid, but I have to use it, she said. Nigerian-born Dr. Chibuzo Okanta with Doctors Without Borders says cholera is easy to treat, and people die because they don't get treatment fast enough. First, patients are given a special rehydration solution to drink, then saline solution intravenously.
And as soon as people can get to the treatment center and they get the perfusions or the oral rehydration therapy, it's all they need. And once they are well rehydrated, they're as good as new.
Doctors say on average patients are better in 3 days. Fritz Pierre was at a party at a local hotel. After eating some meatballs, he began to feel sick. First he went to the hospital, then the cholera treatment center. After 2 days of rehydration therapy, he is feeling better. I told the doctor I was feeling better, and he told me if I feel like it, I can go home, he told us. Dr. Okanta says this facility is treating 100 patients a day, and there have been no deaths here in the last few days. He told us hopefully public information campaigns to seek treatment quickly are finally working. Jeff Swicord, VOA News, Port-au-Prince, Haiti.